How do cell types determine cervical cancer types? Imagine the cervix as a busy gateway between the uterus and the vagina, lined with different types of cells. These cells are the starting point for different kinds of cervical cancer. The two main cell types are squamous cells and glandular cells. The type of cancer that develops depends on which cells become abnormal and turn cancerous. Most cervical cancers are squamous cell carcinomas, making up about 70 to 90% of cases. These cells are flat and thin, like tiny skin cells, covering the outer part of the cervix and the area where the outer and inner parts meet, called the transformation zone. When these squamous cells are infected with high-risk human papillomavirus, or HPV, they can undergo changes that may eventually lead to cancer. This is why HPV infection is a major risk factor for squamous cell cervical cancer. The second common type is adenocarcinoma, which develops from glandular cells lining the inside of the cervical canal. These mucus-producing cells are responsible for secreting fluids and are located deeper inside the cervix. Adenocarcinomas account for about 10 to 20% of cervical cancers, and their rates have been slowly increasing over the years. Like squamous cell cancers, adenocarcinomas are also linked to high-risk HPV infection, but they originate from different cells. Some cervical cancers are a mix of both cell types, called adenosquamous or mixed carcinomas. These contain features of both squamous and glandular cells and are less common. There are also rare types of cervical cancer that come from other cell origins, such as neuroendocrine tumors, sarcomas, lymphomas, and melanomas. These are quite uncommon and tend to behave differently from the more typical types. Understanding which cell type the cancer originates from helps doctors decide on the best treatment options and provides insight into prognosis. For example, treatments for squamous cell carcinoma and adenocarcinoma are often similar, but rarer types like neuroendocrine tumors may require different approaches. Recognizing the cellular origin also emphasizes the importance of HPV vaccination and screening, as HPV plays a key role in many cervical cancers, especially those arising from squamous cells. In essence, the type of cell that turns cancerous in the cervix determines the kind of cervical cancer that develops. This knowledge helps guide diagnosis, treatment, and prevention strategies. Always remember, if you have concerns about cervical health or risk factors, consulting a healthcare professional is essential for personalized advice and care.